If you've ever seen your dog scooting across the floor or noticed a sudden fishy smell when they walked past, chances are their anal glands are acting up. And this is nothing to be embarrassed about. Anal gland problems are common and they can affect even the healthiest dogs. In fact, a large 2021 British study found that over 4% of dogs seen in primary care had some form of anal sac disorder. And that's not a small number considering how many dogs there are here in the UK. So if you've been wondering whether there is something wrong with your dog, don't ignore it. The sooner you understand what's going on, the sooner you can help your dog feel more comfortable. So let's break down what anal glands do, when they can become a problem, and how nutrition can help in preventing future flare-ups. Dogs have two small scent glands located at around the 4 and 8 o'clock positions just under the skin beside the anus. These glands produce a smelly, oily secretion which normally gets expressed during pooping when a firm stool applies pressure to the glands on its way out. In some cases, for example when dogs get nervous or excited, they can also involuntarily empty these glands, which is why that fishy odor might surprise you out of nowhere. In the wild, this smelly secretion likely helps dogs mark their territory. In our homes, though, it's mostly just, well, smelly. When stools are too soft, too small, or if the glands are inflamed or blocked, that fluid doesn't get released properly and it builds up. That's when dogs start scooting, leaking, and showing signs of discomfort. If it goes on for too long, the glands can become impacted, infected, or even abscessed, which is painful and definitely not something you want your dog to experience. How do you know if your dog's anal glands are causing trouble? The most common sign to watch out for is what's called scooting. You'll notice your dog dragging their rear end across the floor, and even though it might look funny, it's definitely not a pleasant ordeal for your pup. Dogs scoot to relieve itchiness or pressure where the glands are full or irritated, so it's worth having it checked right away. A strong, foul, fishy smell coming from your dog's behind can also accompany scooting. It's often due to anal gland fluid leaking out. You might catch whiffs of it on your dog's bedding or after they've been sitting on your lap. Again, not something you want to happen. Another red flag is the licking or biting of the rear end, which can signal that your pup is feeling sore back there. Some dogs with anal gland pain will strain, yelp, or show discomfort when trying to poop as well. You might notice your dog start to poop and then suddenly jump or stop because it hurts. They might also hold their tail lower or act oddly on their back end due to the pain they are experiencing. So if you suspect something is not quite right, you can gently lift your dog's tail. If you notice any swelling, redness, or even a visible bulge near the 4 or 8 o'clock positions around the anus, that could mean an impacted or infected anal sac. In severe cases, an abscess might form and even rupture, oozing pus or blood. Any of these signs are a good reason to check in with your vet. And because anal gland issues range from mild impactions to serious infections, don't ignore the problem if your dog is clearly uncomfortable. The most common short-term fix is manual expression, either by a vet or qualified groomer. This is when someone physically squeezes the sacs to force the liquid out. And yes, it can bring quick relief, but here's the thing. When manual expression becomes routine, it might actually make the problem worse. Some vets warn that repeated manual expression can lead to inflammation and damage in the anal sacs and ducts. Think about it. Those sacs are delicate and frequent squeezing can irritate the tissues. After expression, it's common for a little swelling to occur, even with gentle technique, just from the handling. That swelling can narrow the ducts temporarily. If the ducts swell shut or become chronically thickened, the glands have an even harder time draining on their own next time. Now, This doesn't mean you should never have your dog's glands expressed. When they're full or impacted, it's necessary to relieve the pressure, otherwise they could abscess or rupture. But it's worth understanding that constant reliance on manual emptying isn't a great long-term solution. It's a bit like only mopping a leak but never fixing the pipe. That's why it's important that you figure out why the glands aren't emptying in the first place. One of the most common culprits is small or soft stool. When stool is firm and bulky, it presses naturally on the glands and helps express them. But if your pup frequently has diarrhea, their glands might not be emptying at all. I'll go into more detail soon, so keep watching. The size of the dog matters too. Generally, smaller breeds like Cavalier, King Charles Spaniels, Cockapoo, Cocker Spaniels, and Bichon Frise are more prone to anal gland issues. The gland ducts in little dogs might be narrower or positioned a bit differently, making blockages more common. Anatomical quirks, like if a dog was born with unusually small anal gland openings, for example, can also make impactions more likely. Flat-faced breeds such as Shih Tzus and Bulldogs are also predisposed, with one study showing brachycephalic dogs had about 2.6 times the risk of anal sac problems compared to long-nosed breeds. Chronic skin infections or greasy skin conditions can lead to overactive or clogged anal glands too. When the skin is chronically inflamed or overproduces oil, it can alter the consistency of the anal gland secretions, making them thicker and more difficult to expel during defecation. This change in the texture of the fluid can cause the glands to become clogged or impacted, and if not expressed naturally or manually, it can lead to infection or abscess formation. Weight management is another key element. Overweight dogs are more likely to suffer from anal gland issues because extra fat around the backside can put pressure on the glands or interfere with muscle tone needed to empty them. So, if your pup is experiencing anal gland issues, speak to your vet or contact a canine nutritionist about a weight loss plan, because keeping your dog lean will not only reduce the risk of impaction, but it will also improve their mobility, joint health, and overall well-being. When it comes to anal gland issues, it's often a combination of factors that sets the stage. For example, a dog might be a small breed that is predisposed to such problems and eats a low-fiber diet, resulting in soft stool. Or an overweight dog might also have allergies that cause rear end inflammation. The end result is the same. The glands don't empty fully, fluid builds up, and your dog starts scooting. So, how can you help? One of the things you can look into is diet, as it plays a massive role in anal gland health, particularly fiber. There are two main types. Insoluble fiber, found in ingredients like oat bran or cellulose, adds bulk to the stool and helps it pass through more solidly. Soluble fiber like psyllium husk helps regulate the stool consistency, so if things are too loose, it can firm them by absorbing excess liquid. But if things are a bit dry, it can retain water to prevent hard constipation. Ideally, your dog's diet should include a bit of both. One popular home remedy is plain canned or cooked pumpkin, which actually contains both soluble and insoluble fiber and often helps firm up dog poo. Many commercial dog foods are low in fiber, especially those ultra-processed dried kibbles designed for minimal waste. That might sound convenient for cleaning up after your dog, but less waste means less bulk, and that can be a problem for anal gland expression. Ideally, you'd be feeding your pup a fresh food diet, but if that option is not available to you, you can start by switching to a different processed food. Look for foods with a higher fiber content, ideally 5 to 8% crude fiber or more. Check the ingredients list for things like pumpkin, flaxseed, psyllium husk, or even gently cooked vegetables like carrots or leafy greens. You can also start adding whole foods like plain cooked pumpkin, butternut squash, apples, dark leafy greens, chicory root, psyllium husk powder, or ground flaxseed to your pup's meals, as they can be excellent natural sources of fiber. They're rich in nutrients and are generally well tolerated by most dogs. And don't forget about one of my all-time favorites, bone broth, which is rich in amino acids like glycine that support liver detoxification and overall digestive health. And as we all know, healthy digestive system contributes to regular bowel movements and proper anal gland function. Bone broth can be used as a base for a fiber-rich mixture that helps bulk up your dog's stool. To do that, mix a little bit of bone broth with a teaspoon of psyllium husk until it forms a jelly-like consistency, and then add it to your dog's meal. But fiber isn't the only piece of the puzzle. As I mentioned before, chronic inflammation can also be a factor in anal gland problems, especially if your dog has underlying allergies, whether food-related or environmental. If it's food-related, start with an elimination diet and switch to a novel protein under your vet's guidance, as this will help to figure out which ingredients are causing issues. Avoiding problematic foods will reduce inflammation and help with overall irritation. You can also look into adding anti-inflammatory nutrients to your pup's meals, as they can make a difference too. Omega-3 fatty acids found in salmon oil, sardines, anchovies, or flaxseed oil are powerful natural anti-inflammatories. They help reduce irritation in the gut and around the glands. Another useful addition can be digestive enzymes, especially bromelain, which is extracted from pineapples, as it's known for reducing inflammation and supporting digestion. For dogs with sensitive stomachs, bloating, or inconsistent poops, a blend of digestive enzymes can help improve how food is broken down and absorbed, reducing stress on the gut overall. A healthy gut microbiome supports normal bowel movements, firm stools, and a balanced immune system. So if your pup has constant loose stools, I'd recommend doing a microbiome test, as it will show you whether there is any dysbiosis going on. You will also know what specific probiotics to add to support your dog's digestion and improve gut barrier function. If you can't afford one, you can start adding small amounts of fermented foods like kefir or sauerkraut, as they are natural sources of probiotics. Or you can use a good quality canine-specific probiotic supplement, but without knowing what exactly your dog needs, it might be a hit and miss kind of process. Now, what about common fears around fiber and things like taurine deficiency? And yes, it is a valid concern when diets are poorly formulated or rely heavily on cheap plant-based fillers like beet pulp. But whole food fiber sources like pumpkin, carrots, flax seeds, or dark leafy greens, when given in moderation, don't cause taurine depletion. And when they are part of a balanced diet based on quality animal protein, they actually support a healthier gut without compromising nutrition. That's why feeding a fresh, less processed diet, whether homemade, commercial, raw, or cooked, can make a real difference. Processed kibble often contains rendered meats, synthetic additives, low moisture, and very little variety, which can lead to chronic inflammation, gut irritation, and poor stool quality. Dogs that are fed balanced, home-prepared, or high-quality commercial fresh diets often produce firmer, bulkier stools, have better skin condition, and experience fewer digestive issues overall, all of which can support the natural expression of the anal glands. So if you've ever considered moving to a fresh feeding, this might be your sign. If you're ready to put everything I shared into action, just a few last tips. Anytime you change your dog's food or add fiber supplements, do it gradually over several days to a week, because a sudden increase in fiber can upset your dog's stomach, leading to gas or diarrhea, which is the opposite of what we want. For example, you might start a small dog on just a half a teaspoon of plain psyllium husk or bran mixed into their meals, or a couple of teaspoons of pumpkin. Over a few days, you can work up to a larger amount, maybe 1 to 2 tablespoons for a big dog or a tablespoon for a medium dog if needed. Watch how your dog's stool changes. You want to see it firm up and bulk up, but still be easy for them to pass. Fiber works best when your dog stays well hydrated, so always have fresh water available. If your dog is on dry kibble and you're adding extra fiber, consider adding a bit of water or broth to their food to avoid any risk of constipation. If your dog starts training to poop or skips a day, you might need to dial back the fiber a bit. Also, if you added something like a new protein source and your dog develops itching or diarrhea, they could be sensitive to that ingredient, in which case consult your vet about switching proteins. Lastly, monitor the situation. Check your dog's stool daily. Is it getting firmer or larger? Also, note your dog's behavior. Is the scooting happening less often? Any reduction in that fishy smell or in how frequently you need the vet to empty the glands? It might take a few weeks to see a significant difference, so be patient. Some dogs respond quickly in a matter of days. Others might need a full 4 to 6 weeks on the new regime to really improve. Dealing with anal gland issues can be frustrating for you and your dog. The constant scooting, the surprise stains or smells, and the repeated vet trips are no fun. The good news is that with some dietary adjustments and patience, many dogs experience real improvement. So next time you see your pup butt dragging across the living room, ask yourself, what's in their bowl? Because sometimes the key to a healthier, more comfortable backside starts with breakfast. Thanks for watching. Don't forget to like and subscribe.